Chest pain has a very broad differential or underlying reasons that can present. And you need to know when it's important to seek help for the chest pain and some of the potential signs that are more worrisome for us from a medical perspective. The main kind of systems that can present as chest pain are essentially cardiac, pulmonary, gastrointestinal, musculoskeletal, or more along the psychogenic causes like anxiety. Before we reach a more benign diagnosis like muscle pain or anxiety, we have to rule out the more serious causes. Primarily, when chest pain comes to mind for most people, including us from a medical perspective, we think about, is it the heart? Cardiac chest pain tends to present more when you exert yourself. The profile of cardiac chest pain typically is either a heavy pressure sensation on the chest, like an elephant sitting on your chest, or it can present in a more sharp manner. But typically, cardiac chest pain presents with exertional chest pain. So whenever your heart needs to pump harder, you'll start to get this chest discomfort or pain. And whenever you rest, it should subside momentarily. Apart from that, you can have a pulmonary kind of cause of chest pain. So this could be typically either infectious, so something like a pneumonia or more of a viral pneumonia. It's typically accompanied by other infectious symptoms like either congestion, cough, sputum production, fevers. If you're experiencing that and you start to get chest pain, it is important to be assessed. Similar to a cardiac perspective, we would essentially listen to your heart, get some vital signs like blood pressure, heart rate, O2 sats as well. That would help for the lungs and the heart. After that, you would have potentially, there's several gastrointestinal causes that can cause chest pain. So one would be reflux that can present oftentimes as chest pain and mask itself as if it were cardiac in nature. You could either have postprandial or after you eat. You could have reflux when lying down, reflux. So if the chest pain is more positional, that kind of either alerts us that it could be a gastrointestinal cause, or the other aspect of positional chest pain is musculoskeletal. This is probably the most common cause of chest pain, but it is more of a diagnosis of exclusion. Things that point towards a musculoskeletal cause would be either positional, so if you're in a certain pose and you get chest pain, and if it's reproducible palpation, so if you touch the area and there's a focal tenderness in that spot, that kind of gears us more towards musculoskeletal cause. But again, we have to properly assess and rule out the more serious causes. Lastly, something probably just as common actually or more than musculoskeletal is psychogenic. So a lot of people tend to, if you're having kind of anxiety, panic attacks, you could present with chest pain as well. This tends to happen more if you're having racing thoughts at night, sitting down. So a clue to that is if you're not exerting yourself and you're at rest and you're getting these type of pains, you either need to have, a more serious underlying heart disease, like full occlusion of all your coronaries, or it could be something more along the lines of musculoskeletal or anxiety. But again, these are more kind of diagnosis of exclusion, and we can't presume that it's that without the proper assessment. So I hope that's helpful for you, but I do recommend if you do have chest pain that you just get assessed, and it'll be helpful, because a lot of times more serious causes do kind of seem benign, and it is always better to just be assessed and reassure yourself of the nature.